What number is it? Oh, questions for today. I got it. I
I'll
got it.
just,
Oh, yeah,
yeah.
yeah, yeah.
Yes, and Dr. Shah, you can talk about our recent campaign, vaccine campaign thing, introducing smart villages.
So 4 weeks
Yes,
is
we'll also, yeah.
We are live on Facebook.
okay.
Okay, very good evening to all the viewers who have joined from various forums in India, and very good morning from those who have joined from the US. Today we have with us Dr. Anil Shah, and who is an expert in the field of medicine, and who will be guiding us towards our challenges, what we are facing, of course, as a district, as a state, as a country, towards this pandemic. And let me, Doctor, you want to say a few words to everyone before we start the discussion?
Well, good evening in India and good morning here in the United States. I'm very happy to be here, and thank you very much for coming in. I hope we can have a very stimulating conversation today and answer all the questions. And feel free to talk to us and get all your questions answered. So it's a very productive meeting for all of us together. Thank you.
Thank you, Doctor. So without any delay, I'll start about the giving a little background for those who are not from East Garo Hills. So East Garo Hills is a district in Meghalaya, and we have a population little over 3 lakhs, between 3 to 4 lakhs. And basically it's a hilly terrain, and most of the people are engaged in agriculture and allied. There is a little headquarter which is called William Nagar, and as we all know that Meghalaya, it's a place where it's known for its rains and natural beauty, and it's the abode of clouds. So we get more than 3,000 mm of rainfall. 80 to, I would say, 85% of the terrain and the population you can categorize as rural. And of course, there is a big challenge of connectivity, both cellular and road connectivity. And the other challenges being maternal mortality, infant mortality, and absence of medical infrastructure, and so on and so forth. So during the first wave of COVID, which was during the last year, now we have to first understand that there is not much of a frequent interaction of incoming people, perhaps only for small business purposes. And when it comes to bringing in essential commodities, that is the only way where there is an exchange. And not many people from here go out. And of course, in the whole of year, we had during the phase of the lockdown, we had around 1,100 to 1,200 returnees only. So that can show the kind of closed economy, or closed, you can say, establishment setup which there is. And in that light, we had around 300 cases, 335 cases in the first wave. And unfortunately, one of the persons who was police personnel passed away, and rest all had recovered. So talking about the medical infrastructure, we have a district civil hospital, which is, of course, we now have a COVID ward, and it has 26 dedicated beds for COVID. And we have oxygen support for 6, and we have 2 number of ICU beds. And we do have more than 7 kind of a primary health centers. You can say there are small, minuscule hospitals which has a capacity of 10 beds, and they are located all across the district. And then we have a community health center at one of our major places, which is called Rongjeng, which is a little bigger than a PHC. And then we have 31 sub-centers. Now, sub-centers are very small 2-room setup, where there is a auxiliary nurse is there. One nurse is available for all small kind of issues. And it is also now we are trying to make institutional deliveries possible in these sub-centers. So, but then these sub-centers are not capable of handling COVID. So generally our focus is towards our district headquarter hospital. So now this is a basic introduction about the district. And in this second wave of COVID, we have, as of today, 52 number of active cases. And only one out of that is hospitalized due to some breathing difficulty, but she also is doing good now. And most of these cases are now concentrated in one place called Rongjeng, and the remaining are returnees. So we have all the protocols in place for quarantining, for testing and everything. And we do have a plan because of what we have experienced last year. But now the challenge is with vaccination. Of course, there are a lot of doubts, and there are a lot of questions regarding vaccination. So I think we can start talking about the vaccine, the importance of vaccine, the myths about vaccine, and how we can strategically plan to complete the vaccination process to fight this pandemic. So I pass it over to Dr. Shah to comment on vaccination.
So, Mr. Tembe, vaccination, I think, is the answer for everything. What we are doing at the present time is trying to take it for granted that there is going to be disease and the disease is going to spread, which of course is happening at the present time. But the most important thing is that if you vaccinate yourself, then most of the people, 99% of the time, will not go to a hospital. I think everybody is okay to feel a little sick, but to really go to the hospital and be very short of breath and your lungs completely infiltrated with the virus is a very catastrophic situation. And in order to prevent that, vaccination is a must. So let me give an example, a practical example of what has happened here in the United States. Till late last year, United States was also going through a very bad phase, so much so that people had to literally lock themselves out, not go outside, and the manufacturing had stopped. Many of the shops as well as the supermarkets did not have products. We could not even find ordinary products that we wanted for the daily living. And as a result of which, even hoarding started coming to the United States. This being a very large country and not as populated, it was easier to handle. But I think a similar situation in India would be very, very difficult. So what happens is that you are trying to really protect yourself from having a virus. But once the vaccination started and the vaccines were given to the people, so now, for example, in California, we have 45% of the people are vaccinated already. Now, they are over the age of 18, and young people usually don't suffer from any kind of symptoms usually. Yes, it can happen, but does not happen as frequently. And therefore, they are kind of protected, though we should give vaccinations to everybody. And the vaccines have not been studied on young people, so they are going through those studies at the present time. But what has happened now, that because 45% is being protected, and others are getting there, surely, but definitively. What's happening is that the restaurants have opened, the businesses have opened, manufacturing has opened, supermarkets have opened, and people are going around with their lives. And now they realize, now they advise that you can go out without a mask. Only inside the house or where the large gatherings, you really need to put a mask on. So celebrations are going to start slowly. Disneyland has opened up, and many of these more crowded places have now opened up. So I think vaccination is really the answer. If we were all vaccinated today, we wouldn't be talking about oxygen concentrators and ICUs and things of that nature. I think India being a hub of vaccination, this really should be done. And to my mind, having a couple of million or 3 million people or 4 billion people being vaccinated every day is not the answer. We should have at least 10 to 15 million people being vaccinated on a day time, so that within the next 60 to 70 days, the entire country can be protected. And you would see the difference. The difference is that the numbers would go down dramatically on a daily basis, and At the end of 30 or 45 days, people still get vaccinated, but people are getting more and more confident. So I think the vaccination is the most important thing. So second part is that vaccinations in India are a attenuated virus vaccine. They are from AstraZeneca and the because of that reason, all the research that's done in that area, we get attenuated vaccine. So attenuated vaccine is a not a active vaccine. I mean, not an active virus. It is a killed virus, and that creates immunity by itself. Now, one of the things is that when you get an infection, you develop a natural immunity yourself too. Okay, so that is called as herd immunity. Now, herd immunity can be created either by everybody getting infected or everybody getting a vaccination. Now, obviously, one does not know whether a person has a infection sometimes, especially when they are asymptomatic. If you're tested that you're positive, then you can develop the antibodies, and the antibodies usually last for about 4 to 5 months. So yes, somebody was asking a question. I was just looking at the first question today. The question was that, can we take a vaccination? How long after the infection can we take a vaccination? 90 days is a very good goal, though some can take even earlier. But the Pfizer and the Moderna vaccines, which are available in the United States and the Western countries, and now soon to be available, I think, in India, is a mRNA vaccine. It is a vaccine from a different scientific way to approach to really create the antibodies, and they don't have the virus. And what is now known is that when you give the vaccination, even when you are sick, the antibodies that are created by itself from the mRNA vaccine can literally help to even kill the active viruses in the body. So that's one very good thing about the mRNA vaccines, which are not available at the present time in India, but they will soon be. But all of these vaccines are 85 to 95 to 96% very, very effective. And even if they are, when they say 85% effective, what happens to the remaining 15%? I think they may have symptoms, but I have not heard as yet of very, very significant hospital admissions after vaccination. Means what? Effective vaccination point, which is when you take both the doses and when you have spent about 15 to 20 days after the second dose, that is when you really say to yourself that you're fully vaccinated at that time. Taking a vaccination today and then after 15 days, if you get sick, that means you're not fully vaccinated. You're only about 45% to 50% vaccinated at that stage. And if your effective rate is 85%, then you're 42% vaccinated. Then obviously you will be involved in getting infection, and sometimes you may have to go to the hospital. Though I hope the sickness is not as severe as some of the other people would have it.
Okay.
So
Doctor, one of the common questions we are getting, and in fact, once we posted about this webinar, one of the common questions I received was that what are the various types of vaccine and the comparison of it, and how is there a significant difference between their efficacies? So can you touch upon that aspect?
Yeah, so AstraZeneca vaccines that are available in India today, they are about 85% effective. The Pfizer and the Moderna vaccines, which are there, are 95 to 96% effective. And as we had previously alluded, the AstraZeneca vaccines are the attenuated virus vaccines, which is a Covaxin, and the other name in India. I mean, I'm not familiar, I forgot right now. But they are the two vaccines that are available in India. And now the Sputnik vaccine in Russia is also considered to be about 90% effective. I think getting any of the vaccines is okay. I would not miss a chance of taking a vaccine that's available to you readily. Please do not wait. Because when you get a vaccine, you are getting protected as soon as you start getting it. It takes time for it to build up. But the time is going to be on your side when you first take your vaccination. If you wait for the vaccination to come from the one that you think is going to be the best, and in the meantime, if you fall sick, then it is going to be not going to be very good for you. So I think the vaccinations of the attenuated vaccines are very good. The Pfizer vaccines and the Moderna vaccines are modern. They are more on the genetic basis and the genetic manipulations and things of that nature. So one has to really, from the DNA and the RNA, from the RNA especially, RNA, not the DNA, they are manufactured and they become much more effective in terms of active without getting the virus by itself. But all of them are very, very effective, and one should not miss the chance.
Right, right, doctor. And one more follow-up question on that would be, as you've mentioned, that when the antibodies are developed, they stay for 4 to 5 months. So when we take this vaccine, how long those antibodies will be there? I mean, how long will the vaccines be effective? That is another common question which we are getting.
So the studies have not yet been done, but now we know that for at least 8 or 9 months for sure, these vaccines are effective. Now, it is quite possible that we may have to take a yearly booster shot. It's quite possible, but at least we will now be prepared that these things are going to take place. Now, but nobody knows. So these studies are going on, and the only way to find them out is to see antibodies in your blood to see what's happening. So these studies are ongoing in tens to hundreds of thousands of people to make a standard of what it would be. So once we know that, now we know that at least eight months can go without a problem, that you are fully vaccinated. So I hope it's going to be at least a year, and more, then that will be great. But 8 months for sure, you are protected. But if you're infected, you're protected only for about 5 months.
Great. I think at least it will provide that kind of a security cover till we get that to the level of herd immunity, and till we get all these second wave, third wave, when we cross that, at least that kind of security will be there. So now moving on to another very important aspect is that how do we contain the spread? Because there is a definite logistical challenge when it comes to manufacturing. Because India, today we have 1.3 billion people, in fact, more than that. And if we see the capacity of production of the vaccine in India, combining all the basically whatever is being produced, so they are saying in a year they can maybe come up with 100 crore doses. So, but our population, matlab, at the 130 crores, and even if we want to vaccinate 60% of people, and 2 doses, so that means, and the wastage including, so we will need somewhere around 200 crore doses. So looking at that calculation, so how do we ensure that by the end of this year or by the end of October, how do we, is it possible without importing vaccine, or definitely, I mean, India should aggressively go after importing other vaccines so that we ensure that at least 60% people are vaccinated?
We should import vaccinations. If it's not available, it should be available. Now, one of the things is, so as you know, we run the Smart Village movement, and we are in Meghalaya, and we have a cluster of 50 villages in the East Garo Hills. And we've got people on the ground who are running it. So we work with the government. We work with Mr. Sampath Kumar and Mr. Ram Kumar, who are part of the administrative in the health department, and their secretary there. So what we did as an experiment for the first time actually in India, I think, that's what I was told, is that we went to the villages and started vaccinating people. Now, normally what happens is that people have to go to the centers and get vaccinated. And older people are disabled. They don't have the time. They don't have the ability to go there. They don't have the understanding. They are not sometimes naive. People, of course, even if they're educated, sometimes as the years go by, they go through their own mental changes and confusion. So sometimes it's very important to get the vaccination to the door. So what we did is just last week, we were told that there's enough vaccination available in Meghalaya for anybody over the age of 45. So we targeted that. So what we did is that we went to a village, and of course, villages in Meghalaya are very sparsely populated. The houses are far away, but we asked them to come to a central location, and we had the mobilization factor taken care of. So we started only with 9 vaccinations that were done till now. Okay, people have taken the initiative to take the vaccination. But that day we did 65 vaccinations. And the enthusiasm of the people was amazing. So what we are doing is that we don't want to really wait for people to go to the centers alone, especially when the vaccination is available. Because vaccination should be used as quickly as we can, because that protects the people. Time is of the greatest value here. So we are now going to go to all the 50 villages, which are quite remote sometimes. There are logistical challenges to go there. But we are going to go to all the 50 villages, and in the next 15 days, we would like to vaccinate all the people. I think this has been so enthusiastically welcomed by the population and by the people. I think it was also, there was a press release on that in Meghalaya. But that is the answer to get the people who, not only in the cities, but also the villages to be vaccinated. Because in the villages, we don't have the infrastructure. Just having a hospital bed sometimes and little oxygen that you may get may not be enough sometimes, and you may have to go to a more advanced healthcare facility. But the best way to protect yourself is vaccinate yourself. So if we don't have enough vaccination, then I think we should, life is very precious. We can't take it for as a chance that, oh, we don't know when we will get the vaccine and when we can get one. So we need to really have a massive drive to vaccination, because that will be the answer, rather than trying to go for oxygen concentrator. Of course, we need them, or ventilators, or hospitals. Yes, we do need them. But just imagine if within the next 15 or 20 days, or whatever it may be, and you got massive dose of vaccination going on through the nation, you'll find that immediate, the numbers would go down, dramatically go down. So I think, and that's a much more simpler, faster, cheaper, and better way to take care of patients, rather than trying to, buy expensive equipment, etc., which of course is necessary. We need the infrastructure anyway, to an extent.
Doctor, you touched upon a very important project and very interesting project, the Smart Village movement. So for the benefit of our viewers, if you can just briefly tell what it is and what we are going to see under it. Of course, right now you're focusing on vaccinating all those people from these villages, those 50 villages. But I know it's a bigger project. There's so many dimensions to it. So I think we'll go a little off topic, and if you can quickly tell everyone, because it's a very exciting project for Meghalaya. And I think everyone would like to hear something on the Smart Village movement.
So Smart Village movement is a very different kind of a non-profit. It's a non-profit organization. And what we do is that we try and take a cluster of villages. We got 50 villages right now in Meghalaya, and we have signed a memorandum of understanding with the government of Meghalaya. And we are Berkeley-based, University of California at Berkeley. So University of California at Berkeley joined hands with the government of Meghalaya. And we've got a bank of about 50 to 100 companies, depending upon what the needs are. And the companies are Fortune 500 companies like Microsoft and Salesforce and Adobe, so Google. So all of these companies are with us. And we, of course, Indian companies too, like Tata Chemicals and Wipro, and even Geo. Okay, all of these companies are partners with us, and many startups, which we encourage dramatically, because we want to make sure that our startups are encouraged so that they can become positive business hubs for Indians, for India. So what we have done that we were in the East Kasi Hills, and we've got 8 verticals, which are healthcare, agriculture, education, sanitation, transportation, well-being, so the 8 verticals are together, taking care of all parts of life, security, everything, transportation. So right at the present time, we are focusing on about 4 verticals in the East Kasi Hills. We've got 10 full-time persons working there. And each village also is now putting up an ambassador, a man and a woman, who can participate with the villagers too, for a finite period of time. But the fellows are there for fellows, and the vertical heads are there for forever. They have been engaged for 2 years, but they can be engaged for even a greater period of time. Now, what we do is that we have brought about 25 different businesses at the present time on the ground in the East Kasi Hills. We got Salesforce to put in 2 labs so that you can learn. We got IBM to give courses so the people from the villages and the kids can learn how to do coding, all for free. We got Apollo coming up with several clinics in the East Kasi Hills and the East Garo Hills too. And we've got Gramin Polytechnic, which is coming up in East Kasi. It's already started. We've got many agriculture companies, farmer development corporations, which are there to develop the output of agriculture. And in healthcare, in agriculture, in education, we've got all these, which I just touched upon, IBM, etc. And we are trying to get Pratham for school education. And we've got now one company from Curiosity Gym in Bombay, which will train teachers of how to code or how to teach students how to learn, so it can remain sustainable. The point is that unless the villages develop, unless the villages become self-sufficient, India cannot really advance. India can only be a superpower by name unless we really get the villages to the next level. Villages have to develop, they have to be such that people don't want to go to the cities. They want to stay at home, but still have all the opportunities that they can get by living in a city. So, and in healthy living also, we're taking water, sanitation, housing. We've got some innovative ideas that are coming up. And we started last June. So it's not even been a year, and we already made some tremendous progress. And the government is very happy. And they are trying to expand our area of reach to other districts too. We've been told, please go to other districts and start working. So we want to make sure that businesses come to Meghalaya. And if you have a business, please contact our team, because if you want a business that you can think we can help you. Through UC Berkeley, we teach you how to create a business. We create a lean launch pad, how to create a business, how to evaluate a business, what are the difficulties that you should have in planning a business. All this can be taught to you. And therefore, you can know whether your business is going to be viable or not. It's a very unique nonprofit. And I'm proud to lead it because, I'm still a practicing cardiologist. I've been doing it for 40 years. So my passion for healthcare is never going to cease till I die. But I feel that this is a nation calling for me, for my place of birth in India. And we are just giving so that we can make the people happier. That's really the aim of the entire movement, to make the people happy and sustainable in their lives.
That's really exciting, Dr. Shah, and I really look forward to the expansion. As you said, you're looking to expand, and I look forward to this coming to East Garo Hills. And we would love to collaborate on all these points, and it will be great to see the villages of East Garo Hills also getting benefited from this smart village movement. So let's come back to the topic of the day, and the next thing I want to put out for discussion is the containment strategy. Because yes, we talked about vaccination and we talked about the logistics, and there will be a time which will be needed for the manufacturing, for the distribution, and for it to be given to all the, especially the 18 to 44 age group, which is a big group. India is a young country. Even Meghalaya has the same demography, and we have large numbers in that bracket. So it will be a while till we manage that. So till the time, and in light of the recent surge of cases, what we have to do is to contain the spread. And there are various strategies which have been, of course, adopted. Lockdown is one. And currently, as we talk, we are in the middle of a weekend lockdown in the entire Meghalaya. And the Shillong, which is the capital of Meghalaya, which is seeing many cases. So they are under total lockdown. So here also in East Garo Hills, today and tomorrow, we are having the weekend lockdown. So I want to touch upon the aspect how do we balance between the economy, the rural economy, and the need to close down all these establishments just to contain the spread, because it is giving too much of burden on your healthcare institutions, or it can pose a threat to your healthcare institutions capacity. Because as compared to a urban setup, a rural setup is quite different in terms of the number of people who are daily wage earners is huge here. And they basically work, they go out for work. It's an informal sector. It's not an organized economy. And they go out and look for work. And if the markets are closed, then the day earning is not there. So at the end of the day, how do they buy the bread? How do they earn the bread for the family? So that is a big question. And in the last lockdown, in the last year, from my personal perspective, I feel the bigger challenge was to tackle the lockdown and the absence of jobs and the daily wage earners, to give them employment. How do you make sure that their earnings are safeguarded? So that was a bigger challenge last time. So I just want to know your perspective on this containment strategies, especially from the angle that this being a rural economy. So how do we adopt a balance between containment and the rural economy?
So the most important thing, so it all depends upon where a person is in terms of its needs. For example, if you are not a daily wage earner, then the most important thing that you can do is to stay at home. So washing hands, I would say at least 6 times a day. Using a sanitizer as frequently as possible is very important, and wearing a mask. Now, the mask is not a simple cloth mask. People sometimes say, okay, let's put a cloth mask and we'll be safe. No, it's not true at all. Because with a simple cloth mask, the viruses can easily go through the pores, and you think that you're protecting yourself, but in reality, you're hurting yourself. You need some filter. You need at least a triple cloth mask, but a filter is very, very effective. If you can get an N95 mask, that's even better. So that's number one. Now, of course, if you wear a mask, to a certain extent, you're helping yourself. But make sure that you wear a proper mask, because without having a proper mask, I don't think you're being effective. The second part of the mask is the mask must close the nose and the mouth. Sometimes people, when they mask, they will just wear below the nose and say, oh, I'm wearing a mask. You're not wearing a mask. And you're just fooling yourself that you're wearing a mask. What you need to do is put it right on the bridge of your nose, and you pinch it properly so it remains there. If it comes down, you keep on having that, and adjust your tightness on your ear so that it remains there. So that's very important. So 6 feet distance, wearing a mask, washing your hands, do not touch your face, because when you work, you got the viruses on your hands, and when you touch on your face, it goes straight into your face, and then from there into your respiratory tract. So these are very, very important aspects of it, that you take care of. Now, for the people who are daily wage earners, I think, yes, you can protect yourself. You have to be washing hands again, and keep a 6 foot distance. That's very important. 6 foot distance as much as you can. If you can't, then you've got to wear a mask. Now, for example, in healthcare, we can't keep a distance of 6 feet on a continuous basis. It's impossible. But as long as you wear a proper mask, and you have the containment strategy of washing your hands all the time and keeping the sanitizers available, then I think it will be very, very effective for you to prevent the infection. Extremely important. Now, on the lighter side, they said Queen Elizabeth is still living at the age of 98 or 99, whatever the age may be, at that advanced age. She never went out of the house. Only for specific functions she went out of the house. And therefore, she never had the chance to get any infection. So there is a lighter side of a joke here, that people who are that wealthy and who are the kings and queens, they can live in their own abode and not go there. So what I would say is that even in India, many women who live in their homes, they are not affected because they don't go outside. So try and stay at home as much as you can in the free time. Don't have to go out. Oh, I have to go out and let me go out. Okay. If you got to go for a walk or something, go to a place where it's not crowded. You don't have to go to a crowded place to see people. There's nothing to see people at this stage. This is like you're trying to put yourself into an internal self-isolation so that you can be protected by yourself. But again, when you get a chance to vaccinate yourself, please do not miss it, because that would be your greatest protection of all. I think in Meghalaya, now that you got enough vaccinations for the people above 45, I think the government as well as everybody should put their hands together, that we could literally get everybody vaccinated in a very short time. Meghalaya is not that densely populated. Maybe in the next 10 to 15 days, if all people over 45 vaccinated, then there is vaccines for other people too. And of course, now the government says that they are for there. So we can probably try to overlap that to a certain extent, but making sure that we get a week or 10 days time to make that everybody gets vaccinated. I mean, if in our villages, one village, 9 people only got vaccinated, and just by driving it forward, mobilization, we had 64, so almost 6-7 times more, then I think we can do the same thing for the entire state too, by mobilizing people to where the vaccination sites are and getting them vaccinated. I even told our leaders and all the vertical heads who are working that please go to their homes if you can, so that we can, because people are disabled, people can't walk, people can't move around, they have joint pains. So they should not be given the difficult task of going to a center, you know. But maybe we can go to their homes or maybe very near their homes so that we can just take care of those things. That's what I would do.
I hope everyone got that message, and we understand that there are, of course, for those who have to go out and work, it's unavoidable, and of course you have to, but follow the protocols. And till the time this kind of second wave is ongoing and the efforts for vaccination is ongoing, we all need to avoid the things which are unnecessary, the social gatherings which are unnecessary. Of course, people who have to go out for work, they will have to go out for work, but there are many things which you can avoid. There are crowded places that everyone can avoid. So let us take this message seriously and follow the COVID protocols. Doctor, another aspect I want to touch upon is the impact this whole pandemic is having on the school, our children, because last year, the entire year, mostly schools were closed. And of course, in the other countries, in the first world, we talk about, or in urban cities like Delhi or Mumbai, we can visualize everyone going for that online classes, attending it and having the network and the facilities. But here, if you ask me, if there is a class of 100 students and if you go for online and this thing, only maybe 3 or 4 or 5 people will be having smartphones, and out of them, some will have the network to attend it. So that is the reality right now from here. So because of that, not many people could attend those online classes. So there is a significant gap in the academic, of course, calendar. And there is a psychological impact also of just staying at home, not going to school. So how do we deal with that kind of scenario? Because what it looks like is another few months, it will be like that, and schools will have to remain closed till the curve comes down. So how do we deal with this situation pertaining in relation to our students?
It's a very difficult problem to have to go really meet in person because you will spread the infection. And the important thing and the thing to understand is that you don't only spread infection between the kids, and they can be asymptomatic, but they take their infection to their homes and infect their parents and their grandparents and everybody else around. That's how really the infection can spread too. It's a very important, it's a very frequent route that the infections can spread. And therefore, the lockdown for the kids is not done because they're asymptomatic. And why does it bother us? Because we will not have any problems. But they can be great carriers and take the infection to their homes and infect everybody in their house. It's a kind of protection of the entire population that this has been done. So I think it's very important to understand, because sometimes people blame how come the government is not allowing us to go to school even though we want to, and we are healthy, my entire class is healthy. Yeah, you're healthy because you're asymptomatic. You think you're healthy because you're symptomatic, but in reality, you could also have the virus too. And it's very well known. A pandemic is a pandemic. It does not leave anybody. The presentation of your disease process is different. A young person may not have any disease process that can be exhibited. As you go older, some people can get fever, some people get a cough, sneeze, and then more as you go with risk factors like diabetes and obesity and hypertension and heart disease and cancer and immunocompromised people, they will all be significantly impacted, and they are the people who go to the hospitals and eventually not make it. So that's what we are trying to really protect ourselves from. So as far as the schools are concerned, we of course think that digital learning is very, very important, and it can be really put together up in a very, very short time. What is required is that we have the tools, we have the ability. What is required is to get the computers to to each and every child, and I think we need to probably work on that regard. So these as computers and the things are not as expensive as it used to be. I'm not saying they are not expensive; they are expensive. But I think for the welfare of the state, the government, and the industry and non-profits have to come together so that, a smaller state like Meghalaya, not a big population, I think it is eminently feasible to get these computers and the handheld computers, etc. I think, taking a smartphone, as a doctor, I'm saying, I'm not telling anybody else, the smartphone, reading on a smartphone is not the best thing for you to do, because not only is there a possibility of some radiation around it, but at the same time, there's also the words are so small, it strains your eyes. I mean, I just hope to see what will happen at the end of 20 years when people will be having a lot of eye issues that we got. The larger the computer screen, the better off you are. So at least you should have a proper laptop kind of a computer so that you can see things properly, and work on that. But I think we have to create a situation to give computers to them, because this is not the only time. Nobody expected a year and a half ago that this kind of pandemic would ever be possible. Nobody predicted it. There were no astrologer who was predicting it. Nobody was predicting it. So I think we have to start planning for the future and say, okay, we need to have these digital communications possible. And that's what Smart Village is. Smart Village is creating happiness through digital technologies and open innovation. Open innovation means you open your technology, open your process, so somebody else can help you to improve the process further. So that is how we kind of keep on making changes happen. But at the present time, I think without the classes going on, to go is now obviously if once you're vaccinated, then I think it will be easier for things to happen. The answer is vaccination, again, according to me. But there are practical difficulties. I can't create a solution which really is very difficult to create.
So coming to another important point, it's one of the, of course, points which is being discussed a lot. This COVID is a thing which has happened like in the last, I think it's the biggest challenge our healthcare systems has faced in the last 100 years. What are the lessons India, especially India, I'm talking about, because more or less when we talk of health infrastructure, it's more apart from the urban, this small areas, more or less India is facing the same problem. So let's talk on a country level itself. So what are the lessons India needs to immediately take from this pandemic so that of course, people are also talking about a third wave and the time gap between the second and third, and what all steps the government should take now that it is pretty clear that there will be a third wave. So what are these immediate steps a country like India should take, and what are the long-term lessons from it to take for a rural economy and for a country which, as compared to other countries, has been spending considerably less percentage of the GDP on the healthcare. So what are the lessons for everyone from this current pandemic?
I'm glad that you brought up this topic. So we obviously in Smart Village movement, healthcare is a vertical. All verticals are very important, but being a doctor myself, I mean, I understand this thing far better and understand the implications of what can happen and what we should do. So first of all, I think the most important thing is that you won't have this problem with the COVID part of it if everybody gets vaccinated. Again, I'm coming to the same point. Okay, but let's go beyond that. For the healthcare to be done, what we are trying to do now is to create telemedicine, and through telemedicine, we are able to now go to specialists all over the world that you can really access to. For example, there is an organization known as API, which is the American Association of Physicians from India. And there are 100,000 Indian physicians in America today. And all of these are specialists, they are very well trained, they're board certified, and they're practicing physicians, and they want to give back to their country. So there are many nonprofit organizations right now who participate in that. And we are about to set up a program by which we can get, at least to start with, 10 to 15 physicians who are available to you to talk to you. So if you go to your phone, and we can put artificial intelligence, we've got a program for that too. And the other intelligence can connect you to the to the EMR, and through the EMR we can start talking face to face. So you can be with a physician and talk to the physician and talk about the symptoms and the issues of that nature. We also got a app for psychological issues too. Sometimes people in their own family don't talk about those issues, but you can also try to talk very privately through your cell phone with psychological issues and the advice that you can take. So I think that's the very next step that can happen imminently. We can just put it together imminently and can just take care of it. Obviously, you need the computer or the smartphone. Now everybody has a smartphone, so that's not a problem to really talk to the doctor. And really what you need is advice to take care of it and the prescription so that it can be put together. And we also talk about e-prescriptions right now too. Now, in terms of long-term situation, a health infrastructure is very important. I think the government needs to really increase the GDP spending on healthcare from present 1 to 3%, I don't know what it is right now, 2% or so, to about at least 5 to 6% to grow to the next level. And there are some countries that spend almost 10%, but we should at least go to 5 to 6% to really start getting the facilities that we need. The private sector forms a very important role. For example, if there are psychiatric hospitals in rural areas, if there are healthcare centers, there can be ATMs, there can be ATMs and medications, there can be education to be given on a continuous health channel. All these things can be incorporated as a part of the awareness in the education system. What Smart Village movement has done, and through the encouragement of the Meghalaya government, I think the government is very progressive, and what they've done is that they want to really put what is known as a positive healthcare management. At the present time, what's happening is that people fall sick, they want to go to a doctor. So doctor is meant to cure the sick. But in reality, it should be a little different. It should be that the doctor should also participate in creating a positive healthcare so that it is a prevention of the problems. If you are only going to be sick and go to the doctor, to the hospitals, etc., there's tremendous strain on the infrastructure. Just like what's happening in COVID-19 right now, we don't have enough beds, we don't have enough ventilators, we do not have enough oxygen, not enough personnel, because they themselves are protecting themselves too. They themselves fall sick, they get exhausted, they just can't work that hard. So one has to really try to be a positive healthcare management. What that means is that instead of 80% of the people going to a doctor for a sickness, we should create an environment by which the hospitals are not required, okay, or they don't need to be built. For example, in America, 5,000 hospitals have closed over the last 10, 15 years because the population is healthy. How do they become healthy? So we have taken about World Health Organization standards on 37 parameters right now. From the time the person becomes stunted growth, infant mortality rate, maternal mortality rate, anemia, the height and the weight of the kids. Then, of course, we go to smoking, prevention of tuberculosis, malaria, vaccinations, and to people for diabetes, hypertension, and all the other diseases that we can talk about, which affect the elderly people. What we need to do is to prevent them. So how do you prevent a heart attack? Well, you shouldn't be smoking. That's the first thing. If you smoke, all bets are off. It doesn't matter what you say, you're going to have a heart attack sooner or later. Peripheral vascular disease, hypertension, and all these risk factors, the indirect risk factors that tend to make that happen. Same thing with cholesterol. If your cholesterol is very high, we need to understand that too. Now, it's not possible for everybody to go to a doctor and start getting cholesterol and be so disciplined that every 6 months you'll do it, every 1 year you'll do it. What we need to do is that we are trying to create artificial intelligence by which you'll be reminded, okay, right now your cholesterol. So first of all, we can discriminate to say the cholesterol is say 250 and above. Okay, let's take that population. Okay, and you're over 45 years of age, 50 years of age. You may have a chance to have premature coronary artery disease or the artery disease of the heart vessels, which eventually lead to a heart attack. So we can then say, okay, you're high, so let's try to change your diet, change your exercise, and give you some medication that will help you to reduce your chances of cholesterol buildup in your arteries. That can actually lengthen your lifespan and help you to have a more fruitful life. So these are kidney disease, for example. If somebody's going to have kidney, now kidney is a very terrible disease, dialysis and things of that nature. People's families are uprooted. Of course, transplantation is the real answer. Dialysis is not the answer to the extent. That's only a stopgap measure for months to years to live. But in reality, the answer is transplantation. And sometimes the families are encouraged, which I do encourage, let me take this forum, it's not part of the topic, but I would encourage that families and friends should donate their organs, because kidney donation is not that bad. It's not that dangerous. As a matter of people who donate kidneys are being taken care of so nicely that they live longer than people who don't donate kidneys. So I think these are kind of modern techniques and modern ways to do things will go a long way in taking care of problems. So we are taking now 37 parameters for the entire one block of in Reboy district, and taking 91 villages at the present time. And those villages, which I think there were 40,000 people, will go there, take care of every person, get the blood drawn, and do parameters, and then put artificial intelligence. You also have the chance to get the EMR, but EMR is a very important part of it. You should be able to access your healthcare at any time that you want without any difficulty. That's very, very important. We need to really aim for that. And of course, the private industry in India, I think manufacturing in India and healthcare is a huge field. I think in the United States, if you look at the biggest companies in the world, are all healthcare companies, whether they're insurance companies or whether they are manufacturing companies. You look at Medtronic or Toshiba or Siemens. All of these companies manufacture so many products, and we in India need to really governments to focus. I think one particular state can take a focus that we want to be a healthcare manufacturing hub, take an open innovation, take an incubation center, and start manufacturing EKG pads, for example, EKG electrodes, and then EKG machines. They are being manufactured in India, not that they're not being, but there are so many more, and the quantities required are so many that many industries can be brought up, and that's how really the society can develop and the people can become prosperous. I think healthy and industry and jobs.
That's great. I think India. I hope India is listening, and we will go that way in the years to come. So, Doctor, we'll take one question. We have a lot of questions. We have got a lot of questions, but I think because the time is also limited, and we have almost we have reached towards the end. So we'll take one interesting question. People are asking now that everyone is talking about all these in the light of COVID. A lot of breathing exercises. People are talking about. They are talking about proning. Postures and what is being suggested all over. So people want to know how effective that is and what is the right way to do it. So please, if you can comment on that.
Fantastic question. I applaud the person who asked that question. So when you get sick with COVID, the prone position is very important. And the prone position cannot be for a few minutes. It has to be for several hours. Very difficult to do. What one can do, of course, lying in bed and having a prone position is for the very sick. If you can manage yourself to sit in a chair and be prone down, okay, and maybe prone down to a table which is at your own height of your hip, and prone down and be there, where the air goes to the backside of your lung. The reason to do a prone positioning is the air goes to the backside of your lung, which normally when you sleep is not that active. When it goes to the backside of your lung, you increase the lung capacity considerably, and therefore the oxygen saturation goes up. So prone position is extremely important when you're sick. Breathing exercise, breathing is life. If you do breathing exercises 20 times a day, take a deep breath in and allow the air to go to the remotest part of your lung here, right near the last rib, and feel it. I think that is going to be great in order to expand the lungs, because the food for the lungs is air. The food for the lungs is not food. Okay? So if you put food into your lungs, you're going to die because you are going to have pneumonia and aspiration pneumonia. So food for the lungs is air. Therefore, breathing your lungs deeply is the best thing that you can do. And do that 20 times a day. And that's why the yoga and pranayama and all these things that we talk about has got a science behind that. And the sciences came from experience. And I think the people were very wise in the olden days to follow that. But taking a breathing exercises and having a proper posture and allowing yourself to go through by the hand exercises that facilitates breathing is the best thing you can do. And breathing is so easy to do. You're sitting in a car or in a vehicle, or just at home watching TV. Just take a deep breath 20 times a day, and that will make a tremendous difference in your posture as well as in your ability to handle disease, and your lungs are going to become more and more powerful to take care of the onslaught of the disease that may ever happen to you. And you'll prevent pneumonia. It's great. You'll prevent pneumonia because you're giving food to the lungs. The lungs are saying, give me air. And you're only giving air to the upper parts of the lungs only, because when you normally breathe, you only just, for example, right now I'm talking, I'm only giving to my upper lungs and not to the sides. So take a deep breath right now, all of you, and see what happens. It goes straight into the deepest part of the lungs here, and that will make a tremendous difference in terms of feeding the lungs what it requires to do. So I would say prone position, breathing exercises, and all the yoga exercises that you can do as part of the exercise is fine. If you don't want to do yoga, fine, at least do the breathing exercises so you can get that thing in your thing. That's why when people run, when people what happens, they become short of breath. The short of breath is a sign that your lungs are getting saturated. That's one thing. But it also tells you that your heart is not able to take it more than that. And therefore, you're really pressing yourself to the next level, which you continue to do. So people who walk a lot, people who really do a lot. Of course, nowadays, you should not be walking outside in crowded places. Of course, you can walk when there are open spaces. There is no problem about that. But in a crowded places, there is a problem. So breathing exercise is a very, very good thing to do. And that's why exercise like running or walking or jogging, as you can, they create the same phenomenon by which air goes into the deeper part of your lungs.
That's great. I hope all those doubts are clear with viewers. And now we have almost come to the end. It has been really fascinating, Doctor, to hear about all these aspects. And for me personally, and for all the viewers, I know that there are a lot of new things we came to know, and a lot of insights which we have received. But at the end, again, I would like to request you to, just as a concluding remark, give a message to all the viewers, which basically are, most of them are from Meghalaya and from East Garo Hills, especially about this COVID situation and how they should go about in the next 3-4 months, so that we can minimize the spread and minimize the cases who need hospitalization, and so that we can overcome this current pandemic. So over to you for the concluding remarks.
Well, thank you for inviting me today. But I would say, I think you're very lucky to live in Meghalaya, because it's such a beautiful place, full of rainfall and full of greenery. And it is just great to be there. I've been to Meghalaya for a few days, but I loved it when I was there. So natural beauty is just amazing, and the remotest part of Meghalaya are even more beautiful, of how streams and rivers and just amazing. So I think you're very, very lucky, and lucky also because it's not that densely populated. So you don't have so many people around you that you can get infected from one another. I think staying at home is the best way, especially in the evenings and at nights and weekends. Not going out is most important. Wash your hands, please, at least 6 times a day. Or after anything that you do, that you touch, you should be washing your hands. Use the sanitizers very, very frequently, even after washing your hands. Wear a mask which is effective. An N95 is the most effective mask, but if you wear a mask which has got a filter around it, so that the filters are available easily. You can cut it and put it inside with a pocket and wear a mask with a filter on. And make sure they don't touch your face. And keep the social distancing of at least 6 feet, even in your house. Even in your house, don't sit next to your people, sit 6 feet away. Now, I understand, you require a hug from your mom or your sister or whatever it may be. And you require people to be around you sometimes, but you know that if they're in the house and they're not sick for the last 15 days, the chances of them being infected are much, much less. So try to be as careful as you can. And even if you have to hug, maybe you should wear a mask. People did that in the United States. I did that in my own house too, that we used to wear a mask and then hug so that we would have the family love going around. But at the same time, we are all protecting, one another and each other when, 2 of us are going on. What I would say is that the soonest you can get the vaccination, you should take it. And I would say that you should really press your government to make sure that vaccinations are available to the nearest location that it possibly can be done. I would encourage that very, very strongly, because that's the cheapest and the best way to protect the population. I don't think that we really need to go for very high fancy equipment, etc. at this stage, because it's not possible sometimes. We just facilitated, by the way, 90 oxygen generators to be sent by SmartVillage movement to Meghalaya. They've already been donated by people here in the United States, and I got it down to the San Francisco airport. It's going on the 15th. It'll probably be arriving in Delhi the 17th, and by the 21st or so, you should be having it in Meghalaya, the oxygen concentrators that have been donated. 90 of them have gone by. We want to donate 200 altogether. So all the district hospitals and the remotest areas can get the oxygen generators. So we'll do that part, but that should not be necessary. Let's vaccinate, and let's vaccinate. That's really what it should be. And I don't think that anybody who says, I don't want to get vaccinated and my God will take care of it, or Jesus will take care of it, or Krishna will take care of it, or Allah will take care of it, all that is fine. Allah could have protected us too, and so could have Jesus for people, for what's happening right now. Right now, it's in our hands. So let's not lose the faith in our own abilities to take care of it. And therefore, please make sure that you vaccinate. I cannot overemphasize that fact enough. If I only have to spend 1 minute, vaccinate, vaccinate, and vaccinate. That's really the way to go forward in order to protect yourself and protect the society and have the least amount of hassles for anybody, least amount of suffering for your family, and least amount of suffering for the state and for the healthcare system.
Thank you. Thank you so much, Dr. Shah, for your time and for so many of your insights. And special thank you for sending those oxygen concentrators, 90 of them, which will be coming to Meghalaya. That's great to hear. And of course, the message is clear, as Dr. Shah has said, and I totally concur. Vaccinate, vaccinate, vaccinate. That is the first priority. And all those who are watching, especially from East Garo Hills, 45 and above, we currently are doing so many sessions across the district for the vaccination. Go to your nearest PHC, CHC, or the district hospital and get yourself vaccinated. And soon, as soon as we start the 1844 group, I encourage that group also to come forward in large numbers and do vaccination. So with that, I think we'll end today's session. It has been really great to listen to Dr. Shah. And I hope all the viewers have got the message, and let us work together and to overcome this COVID-19. Thank you so much, everyone, for joining in today. And if you have any more questions, you can always send to the district page and we will address that. Thank you. Thank you, everyone. Thank you, Dr. Shah, once again.
Great pleasure. Thank you.